Good evening, everyone, and welcome to the newsroom of Pharmacology 7246. We're going to take a break tonight from talking about the COVID-19 pandemic and focus on the drug class vasodilators. The last two drugs commonly used in this class is hydralazine and minoxidil. They are used to treat resistant hypertension and peripheral vascular disease. These drugs act by direct dilation and relaxation of arterial smooth muscle, allowing peripheral vascular resistance to be decreased and blood to flow through more easily. Once the blood can flow through more easily, it can get to the peripheral parts of your body, which your body is farther away from your heart, and that helps also lower the pressure in your vessels or in your arteries to help decrease your blood pressure. Both of these drugs are well absorbed orally and widely distributed. Hydralazine has an onset of 45 minutes with a peak of 1 to 2 hours and a duration of 6 to 12 hours. Minoxidil has an onset of 30 minutes with a peak in 2 to 3 hours and a duration of 24 plus hours. Hydralazine is not protein bound and minoxidil is protein bound. Minoxidil has a longer antihypertensive effect. Both drugs are metabolized in the liver and excreted in the urine. You would want to use this drug cautiously in patients who have pre-existing cardiovascular disease because it does not act on the arteries of the coronary arteries of the epicardium. Therefore, when that peripheral dilation happens, it can seal blood flow from your heart. You would also want to be careful with elders who have heart failure because this drug can cause sodium and water retention in those patients, and use in caution with patients who have pulmonary hypertension due to it causing a hypotensive effect in the pulmonary circuit. These drugs are both a pregnancy category C and should only be used when the benefits of using the drug outweigh the risk of using the drugs. Hypotension reactions are the most common adverse drug reaction when using these drugs, but tachycardia, increased cardiac contractility and output, sodium and water retention, and headaches can occur. Hydralazine can cause a lupus-like illness that is usually reversed as soon as the drug is discontinued, and minoxidil can cause enhanced elongation and pigmentation of your fine body hair, and it has also been used to treat male pattern baldness because of this actual adverse reaction. Hydralazine has potential drug interactions with hypertension, antihypertension drugs, beta blockers, MAOIs, nitrates, and alcohol. Minoxidil has potential adverse drug reactions with antihypertensive NSAIDs, nitrates, and alcohol. When you're rationally choosing this drug to treat your patient, it's important to be mindful that it is only used as a treatment, as a third-line therapy treatment in resistant hypertension and peripheral vascular disease. The dosing of hydralazine is started at 10 milligrams times 4 doses daily and increased every 24 hours to 25 milligrams times 4 doses daily to reach a maintenance dose of 25 milligrams to 100 milligrams divided in 4 doses daily until you reach therapeutic effect. The maximum dose of hydralazine is 400 milligrams per day. Minoxidil starts at 5 milligrams per day and is increased every 2 to 3 days to 10 milligrams, 20 milligrams, and 40 milligrams per day. And maintenance, that all of those are in 2 divided doses, and maintenance may be achieved at any of those doses. There's no specific monitoring with either of these drugs outside of your regular hypertension monitoring. And the most important things you would need to know as a patient taking these drugs is to take exactly as prescribed at the exact same time every single day and not to miss a dose. If you miss more than 2 doses, you must call your healthcare provider and let them know and never stop or alter the dose. Always change positions slowly to avoid hypotension and do not exercise in hot weather. Take hydralazine with meals for enhanced absorption. Weigh weekly to monitor fluid retention and report a weight gain of 5 pounds or more in a week to your healthcare provider. It is also always important to monitor your blood pressure and report a decrease of 20 millimeters of 20 to your healthcare provider and an increase of your pulse to 20 to your healthcare provider. A patient should also always try for weight reduction, a low sodium diet, smoking cessation, moderate alcohol intake, exercise, and stress management. Thank you for tuning in about vasodilators, and we will go back to the main news room for more about COVID-19.